Hi, Dr. Teresa Lyons here, creator of Navigating Autism and Eat to Heal Autism. And this week's Ask Dr. Lyons question is: should a magnesium supplement be used now or later for my child with autism? And this is a warning that this presentation is actually for beginners and advanced. Let me explain. Magnesium is many times used both in the beginning of healing from autism as well as towards the end. In the beginning, it's usually used alone, but towards the end of healing, it's used in combination with other supplements that need magnesium as a cofactor. So many times it's used in the beginning, it's stopped towards the middle phase, and then when things get very specific and fine-tuned, then magnesium is used again in combination with other supplements that require magnesium as a cofactor. Needless to say, please work with your healthcare team at each step of the healing. Indications of need for magnesium supplementation: sleep issues, constipation, seizures, anxiety, panic attacks, muscle twitches or cramps, numbness or tingling in limbs, and inflammation. What is magnesium? Magnesium is a mineral that is vital for energy production, muscle contraction, nerve function, and the maintenance of strong bones. Needless to say, magnesium is involved in a lot of biological processes. Its main action is to regulate enzyme activity, to control the activity of various calcium and potassium channels. Those are really important. And also to promote membrane stabilization. Magnesium is also responsible for the maintenance of the transmembrane gradients of sodium and potassium. Again, this is very vital for an optimally functioning body. How does our body get magnesium? Typically, the body obtains magnesium from the diet, and it is absorbed by the small intestine and colon. When the gut is not performing optimally, as is the case with so many of those with autism, then that can interfere with the body getting adequate magnesium from the food eaten. This is why making sure that digestion is optimal, the gut is fully functioning, is so important and is vital as one of the first steps in healing autism. Because otherwise you could end up supplementing without necessarily fixing the problem. And the problem being that the gut is not functioning optimally. So as the gut improves its functioning, it can extract more vitamins and minerals, such as magnesium, and then have better functioning biological processes. Adverse effects of magnesium: it's actually very little. The most commonly reported adverse effects with magnesium is urgency to move the bowels, hyperactivity, and loose stools. The solution most often proposed to that problem is to reduce the amount given. And many times with constipation, this is actually not necessarily an adverse effect. This is actually the effect that is wanted. Another solution commonly explored is changing the non-magnesium counterpart. Magnesium is a cation, a positively charged element, so it needs an anion to counter it. Magnesium is paired with a variety of anions. Magnesium citrate, there's several. So many times, if there is an issue with the magnesium, before just discounting and stopping magnesium use entirely, you can explore a different anion. Magnesium and autism. This is why we're all listening to this video. Studies from 18 different research groups have shown that vitamin B6 and magnesium are beneficial to about half of autistic individuals with no significant adverse effects. So that's pretty profound that 18 different research groups have shown that the combination of vitamin B6 and magnesium are beneficial to about half of those with autism. 11 of those 18 studies involved a double-blind, placebo-controlled design that is the gold standard of clinical trial design, the double-blind, placebo-controlled. And these studies documented decreases in behavioral problems, improvement in appropriate behavior, and normalization of brainwave activity, as well as urine biochemistry. And there's also evidence that vitamin B6 and magnesium, when given together, may reduce seizure activity. And obviously that is very important for those with autism who have a comorbidity of epilepsy. Parents' reports confirm improvement in attention, learning, speech language, and visual contact. There's another pilot study that was done of a moderate dose of a multivitamin. So this is a combination of multivitamin mineral supplement for children with autism. And the results showed significant improvements in sleep and GI problems compared to the placebo group. And again, many of these studies were the double-blind placebo-controlled. And that's the top-of-the-line clinical trial way of structuring to get the most information out. Magnesium as an autism therapy. Here's a quote from some literature. And due to the small number of studies and the methodological quality of studies, no recommendations can be advanced regarding the use of B6 magnesium as a treatment for autism. There's simply not sufficient evidence to demonstrate treatment efficacy. It is extremely difficult to find one approach that will work for all of those with autism. And this is why working with a skilled healthcare practitioner who can see what your child needs is vital to healing. So the literature says about half of those with autism can benefit measurably from magnesium introduced as a supplement. Magnesium sometimes with another supplement. But it doesn't help every single one with autism. Having a healthcare team and working with someone who can really understand the needs of your child, it's absolutely vital to healing. Magnesium towards the end of the healing journey. So magnesium is often used in combination with other supplements towards the end of the healing journey to fine-tune certain biological processes. These fine-tuning, these very eloquent moves towards the end when the gut is functioning, the microbiota is balanced, these are very specific to your child's needs. So again, working with a skilled healthcare practitioner who can see what your child needs at the end of this healing journey, it's absolutely vital to complete that journey. And here are some references.